Bismillahirrahmanirrahim. One of the challenges that has been considered for the second IAI competitions is the tracheal sound analysis for detection of respiratory depressions in adult patients during cataract surgery under sedation analgesia. Sedation analgesia is a method that combines sedation and analgesia to provide a pain relief for patients that undergo medical procedures. It has very many applications in both surgical and non-surgical procedures, and including dental procedure, endoscopics procedure, cosmetic and cataract surgeries. For a patient that a sedative drug is administered, it is necessary that the respiratory function be monitored by the anesthesia team. Commonly used monitoring techniques include pulse oximetry and side-stream capnography. Both of these methods suffer a delay in detecting respiratory complications, but auscultative techniques can reliably and rapidly detect respiratory complications, and therefore these methods are of paramount importance in detecting respiratory depressions. But the efficacy of these methods very much depends on the operator, the continuous listening of the operator, and this might not be practical. Therefore, using real-time automatic and continuous techniques for tracheal sound monitoring and analysis are of special importance. The subject of this challenge, therefore, would be to utilize AI-based algorithm to analyze tracheal sound data for detecting areas indicative of respiratory depressions. After completion of the study, recorded sound were examined by the anesthesiologist to detect periods of respiratory depressions, as defined by occurrence of apnea, breath holding, or airway obstructions that were longer than 10 seconds. Each 10 seconds of tracheal sound data was labeled as 1 for the respiratory depressions and 0 for non-respiratory depression intervals. Two samples of tracheal sound data is shown in this slide. One is associated with a normal respiration, and the other is associated with a respiratory depression interval. The data set contains 254 minutes and 30 seconds of dot wave files, and a number of 7.3% of the whole data set is labeled as respiratory depressions. For the initial phase of the competition, we will ask the competitors to ببخشید این قسمت هم دوباره اشتباه گفتم. For the initial phase of the challenge, competitors will have access to data from 9 subjects along with their corresponding labels. This data set will consist of 9 .wav files named as S1 to S9, corresponding to subject 109, and the labels will be provided in separate Excel files named as label-S1 to label-S9. About the labels, each Excel file will comprise of 2 columns, one for binary ground truth annotations and the other displaying time durations. And each row of the Excel file represents a 10-second interval, with the first row starting at time position 0, and the second row would be the time of 10 seconds, and so forth. Submissions should be organized into a single compressed archive file with the following structure: a main folder that contains a report file and a results folder. The results folder is a folder containing the labels output from the method to detect labels corresponding to each subject of the test data. If you have any question regarding the format of the submission file, please feel free to contact.